3, 2.
We're on our final episode of Cancer 101 with University Cancer Blood Center, also known as UCBC, and Dr. Chang once again is sharing his time with us to educate us all about head and neck cancer. In the last video, just to build off of that, we talked about a team approach, a holistic approach that University Cancer Blood Center has with their patients. And so, Dr. Chang, in thinking about that, who's on the team? What does that mean for a patient?
Right. So, primary treatment usually involves a combination of a surgeon and a radiation oncologist and a medical oncologist, myself. Most treatment is done with radiation or radiation with chemotherapy, and there can be a lot of, difficult toxicities that can affect, speaking, swallowing, and also, mouth and throat discomfort.
Yeah, it sounds like patients would have a lot of symptoms. And thinking about services that are in UCBC, do you all have a Live Well department? Is that right?
Yes, absolutely. Patients, they only see us once a week or, at the most 2 times a week. But, we have services available like the Live Well, and these are, it's a service where patients can be called at home and symptoms can be addressed, symptoms that may have not been brought up during visits or maybe are of a nature that patients don't feel comfortable addressing. And so we have that ability, and we try to address all aspects of patients' needs.
You hear it here first. There is a team approach, a holistic approach to treating patients and having a Live Well department. You have an in-house pharmacy, but for head and neck cancer patients, do you have clinical trials available to them?
Yes, absolutely. We have plenty of clinical trials. With clinical trials looking at adding investigational therapies, immunotherapies, strategies at looking at de-intensifying therapies to possibly find that balance between getting the job done but not overdoing it.
It seems like UCBC has it all covered. And with that being said, a go-to statement at UCBC is, what does it mean to be UCBC Strong? So Dr. Chang, to you, what does UCBC Strong mean to you?
UCBC Strong is meant for our patients. And, I think about it like this. There's nothing else you can do but be strong. But you don't have to be strong by yourself. You can know that you can find strength in your providers and your nurses, in everyone that you come in contact with your family and friends, and draw strength to get you through this difficult battle.
You hear this here first of Cancer 101. UCBC is here for their patients, and their patients are first. Thank you so much for tuning in. Be sure to check out all of our social media channels as well as our website. Take care. Thank you, Dr. Chang.
Thank you.